Hi, everyone, and welcome to episode 149 of the Veterinary Behaviour Chat podcast. And today I'm joined by a lovely vet from the UK, Carole Parsons, who runs an acupuncture clinic in the UK. And actually, Carole and I met quite funnily earlier this year. So when Ben and I were doing our tour of BVA Live in June, followed directly by the Canine Principles Inside Out Symposium, Carole also attended both of those, and we kind of followed each other to both of the conferences, and we got chatting about acupuncture and its role in veterinary medicine. And of course, my interest is, how does it fit in potentially to helping us with our behavior cases? So Carole very kindly agreed to come on and do an episode of the podcast with me so we can dive into that a bit deeper. So welcome, Carole. Lovely to have you here.
Thank you very much. It's a pleasure.
Great. Do you want to just kind of introduce yourself a little bit? Just tell us a bit your story and what you do and what your main caseload looks like over in the UK.
Mm-hmm. Sure. So I started off, like many of us 25 years ago, in mixed general practice, and I had a real leaning actually at that time for the farm side of things. But I did find that I was, being only like 5'2" and just over 50 kilos, needing regular physiotherapy to keep me straightened up, really, after like midnight carvings and wrestling with sheep and horses. So I used to go to a physio twice a week, and once she said, I'm just going to pop some needles in these tight muscles. And that was my introduction to acupuncture. From then on, I was like, this is amazing. I want to be able to use it in my patients. And I did, post-children, I went into solely small animal work, and then I got the chance to train in acupuncture. And I did the ABVA, Association of British Veterinary Acupuncturists Foundation course, which is 4 days of very practical hands-on and theory training. And that's what got me started down the acupuncture route. So I was just using that in my general practice role, loving doing it, but always finding I was never doing enough of it. It was often hard to get colleagues to kind of remember to think about it. It just wasn't on their radar. So, I'd see they'd done an arthritis medication check. I was like, oh, did you mention acupuncture? Oh, no, I forgot. So, yeah. But for me, the feeling of being able to just, acupuncture, you can't just in and out in 10 minutes. You need to spend time with that patient and that client, kind of get to know what's going on. It's not just, what are this list of presenting symptoms, to be able to form your treatment plan. And then you're spending time with them week after week, potentially, maybe for years, giving regular maintenance treatments. And I just loved the way that you build that relationship with that client and that pet. They'll tell you stuff that you'd never find out if you were just seeing them for vaccination checks once or twice a year. So that I just find that really satisfying, and I'm able to offer something that conventional medicine often isn't very good at, which is chronic pain relief mainly. And there are other conditions we can talk about a bit that acupuncture is good for, but I just found it really satisfying. And so at one point when I kind of felt I wasn't enjoying general practice anymore, I was like, I just want to do the bits I love. So that's when I started offering a mobile acupuncture service in my local area. So it means it was just like me and some needles in the boot of my car, very easy to set up. And I wanted to really be able to offer acupuncture to those patients that aren't able to get it in their regular vets. So it just kind of broadens the accessibility really for acupuncture. So that's where I am today.
Yeah, that's amazing. And you're kind of branching out into another field slightly?
Yeah, so recently I have done some foundational training in Western herbal medicine, and I find that really interesting as well. It's kind of fits as a big overlap with acupuncture in terms of we're trying to stimulate the body's own healing mechanisms to help themselves. And again, like kind of targeting things, I'd say at the outset, I'm not anti-Western medicine at all. Conventional, still do the odd locum day. I'm still prescribing antibiotics and anti-inflammatories. But for those cases where the drugs just aren't enough, or we've already got lots of drugs on board, or there's contraindications that we're worried about, it's really nice to be able to offer something else that we know is safe and has got an evidence base behind it. Still quite a few acupuncture skeptics out there, but if you if you go look in the research is there that's on a molecular level as well as on a kind of case study and population level for its efficacy. So yeah, it's really satisfying way to practice veterinary medicine.
Yeah, that's so nice. And I already kind of, just from listening to you, I see a lot of overlap with the behavior medicine side of things. I think that building of the relationship that you mentioned, the taking time, seeing clients back, relatively regularly. I mean, I think you see them probably more frequently than I would see my patients, but still over the course of months and years sometimes. And, being able to build that relationship and understand where the real sort of sticky points are. And like you say, where I think perhaps, in our sort of general normal everyday practice setting, we're sometimes not able to provide that level of support maybe to all of the patients and families that need it. So yeah, and I, when we chatted, when we met each other in June, I think we both also realized that, there's such a lot of crossover, which is really brilliant. So you mentioned just now about the chronic pain piece, which I think is what we all know acupuncture best for, right? Is those chronic pain cases and how they can provide relief. What other cases do you think acupuncture can be successful for? And or maybe you could also explain a little bit further into that chronic pain piece, how specifically acupuncture can help there, and what other conditions is it good for?
Mm-hmm. So acupuncture, yeah, like you say, is really well known for chronic pain. The kind of when Western medicine started to get interested in acupuncture, as opposed to it just being the domain of Chinese medicine, the initial studies, which were mainly like in the 60s and 70s, were very much focused on chronic pain, and it very quickly, good evidence was found for endorphin release. When you stick needles into a body part, you trigger the release of endorphins. And that effect could be blocked by naloxone. So, it was very well documented. And so that is where we have the best evidence and the most consistent evidence for chronic pain. There are also many other ways that acupuncture can tackle chronic pain other than just a big hit of endorphins. So particularly something that I just wasn't aware of when I was practicing, in my early years, the impact of myofascial pain on a patient. So, all the physios out there will be rolling their eyes and saying, yes, of course. But it just wasn't figured in my vet school training. I don't know about you.
Same.
Yeah. And so, those lame dogs, those dogs that have got chronic elbow or hip or stifle disease, they've shifted their weight, they're compensating, and on all their soft tissues in their body are being asked to work in a different way. We're getting overloading of the good joints, which then become sore. And so there's a lot of myofascial pain input to a lot of chronic pain patients. And just, this is what I was finding, I wouldn't say I had a chronic pain condition, but when I was doing those midnight carvings and getting stiff shoulders and back, that was all myofascial pain. It was like tension in my soft tissues, and pop a needle into those tight muscles, sometimes into a trigger point, which can be painful. But I would feel an instant release, and again, that's been well documented. There's some beautiful studies, electron micrograph studies done by a researcher called Langevin in Canada, which shows that the fascial tissues, the connective tissue, actually winds around the shaft of the needle and creates these little whirlpool effects. And so you can actually kind of unwind the tight fascia that's been wound the wrong way and release the tension that way. There's also very good evidence now of its effect on central sensitization effects. So this is where we're kind of straying a bit more into behavior territory.
Yeah.
But neurotransmitters that activate brain regions that are associated with chronic pain, things like the amygdala, is overlap with like fear and anxiety with chronic pain. One of my very good tutors says chronic pain is a chronic stress. So basically the body is under constant stress when the body's under chronic pain effects. And we can interrupt descending inhibition pathways. We can downregulate that sensitization that's happening in the local nerves and also in the central nervous system via acupuncture.
Yeah, I mean, that's so cool. And like you mentioned, I think that's exactly where it starts to become really exciting from a behavior medicine point of view, because you can start to see, how that would have an effect not just on the behavior cases that we see that have chronic pain and that's part of their behavior presentation, but also on those patients where we do have limbic overdrive, and we've got these patients going directly to their limbic system and their amygdalas for fight flight responses, and that whole kind of dysregulation of the nervous system and so on. So I think that's really exciting to see that there is a little bit of crossover, because I guess my question, and I know I asked you this question when we met in June, is, is there any evidence, or have you seen, even just kind of in your clinical practice, acupuncture have any kind of positive impact on like true behavior presentations such as fear, anxiety, stress, over arousal, all those things? Mm-hmm. Do you think there's a place for it?
Absolutely, I do. Like I said, it's often these fear, anxiety conditions. I have to preface my answer with the fact that I am not a behaviourist. So please excuse or correct any
all good
information I give. But particularly when we've got this sympathetic overdrive that's driving these responses, we do have evidence that, as I say, that acupuncture can downregulate neurotransmitters that are involved in that response. That they can actually target the sympathetic nerves that are kind of overreacting, if you like, in those situations. And there's a massive overlap between pain and emotional ill health. You know it, I don't need to tell you, but in human medicine, it's been known for years that people with chronic pain are much higher risk of anxiety and depression. And those things can feed into each other. So if you've got an animal that's kind of trying to tackle a slippy floor every day to get to its food or water bowl, and it's got joint disease, that causes anxiety because it doesn't know if it's going to get to the other side of the room without slipping and tripping and hurting itself. So that animal has that emotional input to how it feels. And chronic pain is not just a sensory thing, it's it's an emotional thing. There's suffering there, and that's what we as vets want to relieve, isn't it? And so I believe there's a massive overlap. We've got I was just kind of reviewing the research this week before I've spoken to you. We've got evidence of effects on cortisol levels, noradrenaline, serotonin systems, and as I said before, those brain regions. You can do a functional MRI study, pop some needles in a foot or an arm, and you can see that those brain regions are being activated just from the needles in the distal limbs. So yeah, I think there's a massive potential for it, and I think I sadly haven't been asked to do many behaviour cases other than those that are, chronic pain and behaviour has come into it. But I have got a patient who's recently, I've been recently seeing, she has many conditions going on, bless her, hip dysplasia, IBDD, some lumbosacral stenosis recently diagnosed, also been super reactive anxious most of her life, came from Dog's Trust. The owners are very onto it. She has regular behaviourist input. She has regular physiotherapy. I've only come in the last couple of months, but despite all their work, they've always had to be super careful about taking her out, not meeting this dog that looks like this, or a cat crossing the path, or tractor going by or something, and thunderstorms. And they said, the first 3 sessions I went happened to be on a thundery day, and they said she just slipped through the thunderstorm. We've never had this before. And the more I've been going for about 3 months now, they're saying she's like a different dog. We can take her out. We saw that other dog, it just crossed the street. She looked at it. I could distract her straight away and walk on. She said that would have been game over for that day in the past. So that's a really strong, obvious case where she's had all these interventions. I've come in late, so I'm quite confident that it is the behaviour, because often you're using lots of different treatments and it's hard to know what makes a difference. But in their case, they've been working with this dog for 6-7 years, and since the acupuncture started, they've seen a marked improvement. So that's obviously very satisfying, even though I wasn't brought in to deal with that condition.
That's brilliant. And, and that is so satisfying, being able to help those patients, that those are the ones that sometimes kind of fall off the radar a little bit, right? Or, just, I don't know, maybe aren't worked up as thoroughly, or, but being able to help those sort of cases is just so lovely. I agree. So moving away from the chronic pain side a little bit, I actually had a really interesting, so I run a monthly membership called the Behaviour Case Collective. And a few months ago, I did a GI case together with Dr. Anne Batson. And in the discussion that kind of followed afterwards, we've got another acupuncturist, Dr. Kate Rue, who's in that group. And she had mentioned, because we were talking about GI and behaviour and so on, she had mentioned that she had quite successfully used acupuncture for a GI case, which ended up also being behavioral because the dog had real trouble eating at all, so was inappetent, and all the clinical sort of signs and bits and bobs had been thoroughly investigated, and it was acupuncture that ended up making the difference and that kind of stimulated the dog to eat again. So would you say that you've had similar experiences, or are there other body systems that might cross over with behavior that acupuncture can be really useful for?
Yeah, I mean, acupuncture is just really helpful for any chronic inflammatory state, I would say. There is quite a good body of evidence for like IBD type conditions. I think there was a large study on police dog German Shepherds, which showed that acupuncture was effective in those. And yeah, it's a bit like, like I said at the beginning, you're kind of looking at the patient, you've got time to spend with what else is going on with that patient. You're not just there for that one condition. So something that we do with acupuncture, which is kind of, I guess, what you'll be looking at as well from a behavior point of view, is what's everything going on for that patient, in their life. What are the environmental triggers? What are the dietary triggers? What are the medical conditions that are going on? And yeah, I think gut pain is actually very under-recognised in behaviour cases, but also chronic pain cases generally. A lot of them are obviously on long-term non-steroidals. There's probably a lot of them that have some low-grade gut irritation going on, and it's just, they're a bit off their food today, or they have diarrhea once a week, and we don't really assess, we don't really check for how much that gut pain or that gut irritation might be feeding into their pain picture or their behaviour picture, in terms of they're anxious to eat, or they're anticipating gut pain when they eat a meal. That's that's kind of two survival systems in conflict, isn't it? Which must be very stressful and cause a lot of emotional turmoil in an animal's head. I've got to eat to survive, but it's going to hurt me to eat. So yeah. I mean, go on.
Yeah, go ahead.
I was just going to say, so I think often inadvertently I'm probably helping with gut pain without knowing it if I haven't worked it up. And I did listen to your podcast with Amber the other week, and it really made me think, wow, I want to start incorporating some kind of gut health assessment into my patients to make sure I am kind of, if that's there, I'm not missing anything. I've started more and more to kind of build a chronic pain support package around the acupuncture. So in terms of home assessment and just checking what the medication is like, and cognitive and gut health are things that I think I really need to add into that, to make sure that, when, as I say, I'm not missing anything.
Yeah. And I think that, again, it's so interesting listening to you say that, because I think over time, my own behavior practice has evolved similarly. I think when I first started, for sure, at the beginning of my residency and kind of throughout my residency, the questionnaire would be very much focused on behavioral signs and all the environmental and social factors that were surrounding that. But as time has gone on, and as we've learned more, that we've now got chronic pain questions or pain questions in the questionnaire. We've got, questions relating to behavior around eating, which then points towards the GI system, and even things like how often does your dog defecate? What's the stool quality like? And the same thing, cognitive dysfunction. We screen for cognitive dysfunction. Every patient over the age of 8 gets a Disher questionnaire sent to them automatically. So I think it's brilliant how these sort of more, I guess, holistic disciplines are evolving to start to recognize, hang on a minute, everything has a knock-on effect on everything else.
Everything is connected, absolutely. Yeah, no one body system operates in isolation, does it? And I think, for all, I'm not Chinese medicine trained, I don't understand it particularly. I feel that that's where Eastern medicine kind of got it right in terms of not breaking things down to isolated points, but just, everything is connected. We need to look at the body as a whole to see what is impacting on what else, and the effects that have. And it's really exciting to kind of make those realizations sometimes, and put the pieces together in the patient in front of you, and have a little aha moment. No,
that's so cool. So having said all of that and how brilliant acupuncture is, what do you feel the limitations might be of acupuncture? Where do you see, I mean, obviously if a patient has a broken leg or an abscess, then we need to go in with other tools, but do you think there are any limitations, or would there ever be a case where you would say, oh, this is maybe not one for acupuncture, this, we maybe need to go back to the drawing board or reassess? What do you think?
So well, the first limitation I would say is perceived rather than real. So I did mention at the beginning that there are acupuncture skeptics out there, sadly, still, and I think there is a belief that there isn't much evidence for it, or we don't really know how it works, and therefore we don't want to try it. I've tried to counter that, and if anyone's interested, I can definitely point them to some good research, quality research. But because you can't do kind of case control studies, you can't pretend, well, people try to do what they call sham acupuncture, then it is very different to have difficult to have a placebo treatment alongside acupuncture to get those gold standard studies. However, as I said, there's lots of other research out there, even on a molecular level, or functional MRI studies. But I would say that the main thing to recognize is that there is a very individual variation in response, and there are what we would class as good responders. So that would be me, who feels an instant relief from having needles stuck in their tight trapezius. But there are also those animals that don't seem to respond very well, and the majority are somewhere in the middle. So I always need to preface my treatments with, this may not work for your pet, but we won't know until we try. And it may be amazing. It may just be another tool that we can use to help your patient alongside all the other things you can do. Or it may be that after 4 or 6 sessions, we're not really seeing any improvement, and we decide, okay, this isn't the treatment for your pet. The other thing I would say is, if I have got an animal that's been in uncontrolled chronic pain for some time, a lot of hyperesthesia there, a lot of anxiety around touch, then sometimes the needles are just too much. So I do have a laser acupuncture pen, and sometimes that is they will accept that, and sometimes that can be a gateway into using needle acupuncture. But I do have patients who are just terrified of being touched, and so I can't use needles on them, obviously. And then it's a case of, okay, this isn't, go back to the drawing board. We need to actually see, is the medication protocol adequate? What other things can we do? Maybe your pet would respond better to massage than acupuncture to help with that myofascial pain, that kind of thing. And I think, they're the main kind of limitations, really. And obviously it is a very involved treatment. You need a client who's prepared, up front to pay for at least 4 or 6 sessions, knowing that there's no guarantee of a good outcome. They need, an hour once a week or once a fortnight to put aside. That's a big commitment for some people if they're working full time or got caring responsibilities. So in those cases, it does seem easier just to pop a pill. But you'll have the same with your behavior cases. It's not a quick fix, is it? And we're dealing with a chronic condition who's going to need, chronic maintenance over time. And it's not for everyone for those reasons.
So absolutely. And actually, as you were talking there about the limitation ones, the ones you can't touch, that's actually, a lot of our behavior patients are phobic of people, other people, strangers, that's what perhaps what part of their diagnosis is, and you kind of say it would be really amazing to get your pet to have either some physiotherapy or some acupuncture, and you just know that pet is not going to tolerate it. It's either the environment or it's the unknown person. In a lot of cases, or in some cases, that changes as perhaps the animal gets to know the therapist, and there's a relationship that's built up, and because of the time that's taken, and oftentimes the environments that we practice in, I think that can change. But that is actually, especially in some of these real intense and aggressive behavior cases, right? We also I don't want to send a dog to a physiotherapist or someone like yourself knowing that they potentially could bite you, you know, so we've got those limitations, I think, there as well.
Yeah, no. And sometimes owners are willing to consider sedation to help with acupuncture to see if that works, and sometimes they're just not. You know, so some dogs might be on, you know, gabapentinoids for chronic pain, and we can just double dose them on the day I arrive, and that's a way to kind of help get them acclimatized to it. But I do think I've got an advantage of seeing them in their own home, so I'm like 90% mobile, home visit based. And so a lot of animals are in a much better emotional state than they would be if they just made a car journey and sat in a noisy waiting room. So yeah, that's always helpful. But yeah, there are just those, you know, I've arrived and the dog's just barking at me from the other side of the room and I can't get near it. So
exactly.
And then, yeah, we have to kind of, okay, do we have a plan B, or do we just decide isn't the right treatment for your pet? Yeah.
And so you just mentioned earlier there that sort of 4 to 6 week, you know, plan at least. What does a kind of a regular or sort of an average acupuncture protocol look like? How many kind of weeks or months would you say that you would normally treat a patient for?
Yeah, so we know that we need a few treatments in fairly quick succession, so ideally bi-weekly or weekly, to kind of prime the nervous system to respond most effectively. As I said, you will get those amazing responders who after the first treatment they're like, this has made a big difference, but that isn't normally sustained. It might, after one treatment, you maybe only get a day or two of improvement and then they return to baseline. So by getting in several treatments in a fairly short space of time, 4 to 6 weeks is the kind of standard recommendation. But I always preface that with, if we've got a very ongoing chronic pain condition, if we've got chronic neurological conditions, so we haven't really talked about that, but I do see a lot of cases with the spinal conditions, and there we're asking the nerves to regenerate. So that's obviously, again, not going to be a quick fix, and it could be 2 or 3 months before we see significant changes. And again, a big commitment from an owner to ask from an owner for that. But yeah, what I would normally do is let's get in at least 4 treatments if we think we're definitely seeing a good response. And I'm very aware of bias. You know, myself and the client are going to be biased towards this treatment because we're both invested in it.
Right.
And, you know, particularly with pain, owners, it's been shown that owners think if they're given something, then the pet's pain improves, even if objectively it doesn't. So I always use pain scoring tools kind of before and after the baseline sessions to try and bring a bit of objectivity into the discussion. And then we decide whether we feel that it is worth continuing if we're seeing a benefit, or maybe, as I said, it just isn't the right treatment for this pet. If we're continuing, then depending on how well they're doing, after 4 weeks, I might say, okay, let's try a 2-week interval and see if we get any reduction in response, any deterioration in that time or not. And then we basically kind of play around with the intervals to find what we need for a maintenance treatment. So most of my maintenance cases are on either 2, 3 or 4 weekly, just depending on what their needs are. Sometimes we'll go to 4 weekly and then it gets to winter and they'll have a flare up of their OA and we kind of increase the frequency for a little while. So that's basically what I do. And so some of my patients I'll see for like 2 or 3 years like that, and then and you know that they wouldn't have made it that long without the acupuncture, so that's really, really good.
Yeah, that's amazing. Wow, that is pretty intensive. So I'm actually also a good responder to acupuncture and dry needling, and I actually have a really funny story from sort of way back in the day. So when I was still at vet school, we had an exchange program with the university in Taiwan, the veterinary university, and myself and 2 of my friends, we went over to Taiwan, and we actually spent a couple of those weeks in a Chinese medicine hospital. So it was a Chinese medicine combined. So they had like Chinese medicine on one side and then Western medicine on the other. And it was really interesting because the Chinese medicine practitioners would go over to the kind of Western hospital and you know, treat really some quite acute trauma cases there with acupuncture and herbal medicine. Anyway, as we were there to learn, this was all human people, medicine. one of the practitioners said, does anybody have any aches or pains? And I had like for the preceding, I don't know, probably 6 months, biceps, like pain in this right biceps tendon. And I said, yeah, I've got some like pain in this biceps tendon, and it's really like, it'd been irritating me for a while. And he looked at me and he was like, oh, okay, right, yep, we can do some needles for that. And then it was early in the morning. He asked me, have you had breakfast? And, I was like, what, in my early 20s then? And I was like, no, but I'm fine, and they looked at me a bit like, and I said, no, it's fine, just go ahead. Anyway, so I was sitting there, and I remember my best friend was facing me, and they went ahead and popped a needle in, and I just saw her eyes go really big. And I said, what? And she said, like, the needle's just gone in like really, really far. And I didn't feel a thing. And then, of course, lo and behold, 2 minutes later or a minute later, I started to feel a bit dizzy and had ringing in my ears. And so they ended up having to like pop my legs up, and I had a bit of a vasovagal episode. And, that's that's why we asked whether you'd had some breakfast or not. But from that day forward, I never had that biceps tendon pain again.
Yeah. Wow. That is quite an intense response. Lovely. Yeah. And that's it. And sometimes you get a case like that, and it does feel a bit like magic. I've been saying there's lots of evidence, it's very scientific therapy, but yeah, it is a very satisfying. When you get those really strong responses, it is so satisfying to see that. You feel like, you've just changed that animal's life. So yeah. Oh, that's a lovely story.
That's a bit of a funny story, I know. And the reason why I've always been quite an advocate, and I have not yet learned how to do acupuncture myself. However, I am very strongly considering doing it either later this year or early next year. And I just feel from my own personal experience, that experience in Taiwan, and then the more vets I speak to that practice acupuncture, and I've had acupuncture for my horses over the years, I'm a strong believer, so I'm not an acupuncture skeptic. But yeah, I was really curious to see how acupuncture could fit into the behavior world. Yes, chronic pain, but outside of that, how we can maybe actually help mental and emotional ill health, true mental and emotional ill health that comes from neurotransmitter imbalances with the help of acupuncture. So it's really nice.
All your audience will now be referring to us acupuncturists, because I say I don't see. I think I've only treated 1 or 2 pure behavior cases over the years. So yeah, it'd be lovely to see some more.
Yeah, definitely. Well, we will definitely link your contact details and your information in the show notes. So if anyone listening, where in the UK do you practice? What region are you in?
I'm in Nottingham, East Midlands based.
That's right.
So yeah, I travel kind of around most of the East Midlands. Okay. And if I don't, then there's a very good postcode directory on the ABVA website, so you can find an acupuncture vet if you're not in my area. To refer to, and that they've had some basic foundational training. Also, any non-vets out there who are listening, it's important to know that it is illegal to practice acupuncture on animals if you're not a registered vet in the UK. There's probably different rules in different countries. So yeah, that you should be looking for an MRCVS who practices acupuncture if you're referring.
Yeah, 100%. And maybe we can get that website from you as well, and we can link that, and we can link more details. So if anybody listening is based in the East Midlands and thinks that Carole could help, then please go ahead and get in touch. Yeah, amazing. Is there anything we haven't talked about? Is there anything else that we've missed that you feel you wanted to mention, or do you think we've covered it all?
No, I don't think so. I'm just looking at, I think, there was an article in the British Medical Journal a couple of years ago that was just saying acupuncture is vastly underused in human healthcare, and I just think the same is true in veterinary. It's just never up there as a kind of early consideration. Often the cases I see are kind of last resort, sadly, in terms of pain and mobility. So yeah, it would be lovely if acupuncture was considered earlier on. It's covered by insurance in most pet insurance policies. So for that reason, finances don't have to be a barrier. And it's incredibly safe. A lot of the drugs we use, and we doling them out commonly, non-steroidals being an example, they're not benign, are they? Every drug has its pros and cons. And for those animals where you feel like, do I need to add in another medication, or the owner's getting a little bit sick of all the pills, or you're dealing with a chronic pain condition and you think this animal's quality of life just isn't as good as I'd like it to be. I'd just like you to think of acupuncture. Just give it a thought. And and I myself, I would always, if anyone isn't sure whether acupuncture would be appropriate, like you mentioned, broken legs, abscesses, sometimes a client will contact me directly and say, oh, my animal's got this and this, do you think acupuncture would help? And then when I dig a bit deeper, they haven't even been to the vets yet, their own vet, for any kind of basic workup. So I do operate on a referral only basis for that reason. I want to be sure that the animal isn't missing out on any kind of conventional workup or diagnostics and skipping straight to the acupuncture, because that doesn't help me either if I haven't got that information.
Yeah, no, absolutely. And I mean, it was a little bit droll of me to say broken leg. I think probably once the broken,
it's amazing what people think acupuncture can do sometimes if they are a believer. So
I know, but once the leg's been fixed, though, I think acupuncture could be really good after that.
Absolutely, in terms of rehab, absolutely should be part of the rehab plan.
Yeah, exactly. So there is still a case for acupuncture in a broken leg. It's just after the leg's been fixed.
Yes, yeah.
Amazing. Well, thank you so much.
I have to say there is good evidence for electroacupuncture helping in non-unions and malunions. So.
Oh, really? Oh.
Yeah.
See, I mean, it's a whole new limitless world of new possibilities. So
yeah.
Brilliant. Thank you so much, Carole, for your time. What a wonderful conversation that was. I loved it. I loved learning a little bit more about acupuncture, even though I am a believer, definitely. But yeah, it's just so wonderful to hear the type of practice you've been able to build. And obviously, you really enjoy what you do, which is great. And, your patients, I'm sure, benefit so greatly. So yeah, I'm really grateful. For all of you listening, I hope you found that interesting. I hope that's given you a little bit of food for thought for acupuncture. And I'm going to link the bits and bobs that Carole mentioned in the show notes, so you can find that website if you're looking for an acupuncture practitioner. We'll get Carole's details in the show notes as well. And then if you're interested in joining the Behaviour Case Collective membership that I mentioned, where we had spoken about that GI case, I'm going to put that in the show notes as well. We've still got a few spots going at the early bird price. You can either pay monthly or you can pay annually. If you pay annually, you get 2 months for free. But yeah, it's very, very affordable, and it's a brilliant membership. We kind of deep dive into a behavior case every month, and we've got like nice literature searches to go with that and lots of conversation afterwards. So if you're interested in veterinary behavior medicine, that's definitely a good space to be. But for now, thank you so much, Carole, and we'll see you. My absolute pleasure. And we'll see everyone next week for episode 150. Bye for now.